Hello, everyone. My name is Ben Horowitz. Welcome to our event today. I work in the Community Development and Engagement Division here at the Federal Reserve Bank of Minneapolis, and I'll kick us off with a brief disclaimer. The views you hear today are those of myself and Suzanne, and don't necessarily reflect those of the Federal Reserve Bank of Minneapolis, the Board of Governors, or the Federal Reserve System. We're here today to discuss the third iteration of a survey that staff here at the bank have worked on in partnership with First Children's Finance for 3 years now. I'm so grateful that you've all found time to join us and hear about our results. I saw some names on the registration list of folks who are third-time attendees and some who are here for the first time, but I know you're all very busy and appreciate the time to hear about our work. If you'd like to see our prior year's presentations, those can all be found on our website at minneapolisfed.org. You'll also find articles on the survey written by my colleague in the bank's Public Affairs Department, To Win. Soon after we wrap up today, a recording of today's event will be posted along with the slides, and To Win will be writing up another article on this year's findings too. You can also point your browser to First Children's Finance's webpage. First Children's Finance is a nonprofit with a 3-decade track record of work building the supply and financial sustainability of childcare in Minnesota. First Children's Finance focuses on the business side of childcare. They provide training and consultation services, and they also work with rural communities to assess and address their local childcare needs at a community level. They're a community development financial institution, meaning they can provide needed access to capital through loans, forgivable loans, and grants to childcare businesses. Their Minnesota section hosts a detailed report on last year's data on their webpage, and also has a lot of other helpful content on the childcare sector. They're also the brains behind ruralchildcare.org, a resource I frequently point people towards in our district. One last bit of housekeeping. Suzanne and I have reserved the last part of our time together for questions from you. You'll notice the chat function isn't active in this Zoom window, but the Q&A function is, so please click on over there at any time during the presentation and drop your question in there, and I'll be tracking those for the duration, and we'll try to get to as many as we can before the buzzer. With those practicalities out of the way, I'll provide a bit more background on this project. The Fed pays attention to childcare as it does to any number of issues because it's our job to understand how the economy in our district is functioning and changing. And economists here at the Minneapolis Fed have been looking into childcare for about 20 years now. Some of the work was foundational to the conversation about the public's return on investment from dollars invested in providing high quality early childhood education to families with low incomes, a conversation that's still going on today. And there's also a separate but related conversation about the health of the childcare sector more generally that's been garnering a lot of attention nationally and locally. So work by Fed economists in our district, along with people at a national level, have shown a connection between parents' ability to find affordable care and ideally quality care when they need it, and the ability of parents to fully participate in the economy. In other words, when the childcare sector is struggling in a region, there can be ramifications beyond those for individual households or children. This is something we see time and again in data, and something we frequently hear about on an anecdotal basis from workforce development professionals, business owners, and community leaders across our district. So this survey was born out of a desire to better understand how the childcare sector is doing in Minnesota. It began during the height of the COVID-19 pandemic. As that virus has become less at the front of our minds, as Suzanne's presentation will show, other challenges of contemporary economic conditions are still very much at play for childcare operators here in Minnesota. So with that, I'll turn the mic over to Suzanne. She's the Minnesota Director for First Children's Finance and is an expert on the business side of childcare.
Thank you, Ben, and good afternoon, everyone. Before we get into the survey results, we'll share some detail about who answered the survey. We got a fantastic response from the childcare provider community. I don't expect that there are many providers on the webinar right now, given that it's lunchtime and they're likely busy feeding the kiddos, but I'd like to say thanks to any childcare providers listening in. Currently, there are about 8,000 licensed childcare providers in Minnesota. Just over 6,000 of those are licensed family childcare, and just under 2,000 are childcare centers or other programs. The other category here would be Head Starts, preschools, or after-school programs. So our respondents are fairly reflective of that breakdown. with a slightly higher representation from family providers. With more than 1,000 responses, this survey represents roughly 13% of licensed childcare programs in Minnesota. Our regional breakdown is fairly consistent with statewide licensing data, with Greater Minnesota slightly overrepresented in this survey. Of those providers who chose to report their racial or ethnic identity, 6% identified as racial and ethnic minorities and 88% identified as white. There is no public data in Minnesota about the demographic diversity of childcare business leadership, but this breakdown, from what information we do have, seems pretty close to actuals. And one thing to keep in mind is that our survey went to childcare business leadership, family childcare businesses, or center directors and owners. The broader childcare workforce, which includes classroom teachers and teachers' aides, is a more diverse group. So those are our respondents. Let's see what we found out. A critical indicator of the health of any business is revenue. And make no mistake that childcare programs are small businesses, whether they are a childcare center or a home-based licensed family childcare program. And businesses need revenue to survive. Many of you watching today are already familiar with the childcare sector and know that enrollment, or the number of children signed up at a given childcare program, equals revenue. As your enrollment goes up, so does your revenue, and vice versa. The first 2 years of this survey, in which we asked about the first 2 years of the pandemic, showed significant decreases in enrollment. Childcare providers were losing money. This year, our survey shows that childcare enrollment is finally starting to stabilize. That's the gray section. And for the first time since doing this survey, a majority of all programs, regardless of whether they are a family program or childcare center, report either stable or increased enrollment, the yellow and light blue sections to the right. So this is better. But let's look a little closer. There is still a large number of programs reporting decreases in enrollment. 35% of family providers and 29% of centers report either large or slight decreases in enrollment. That's still a significant share of the sector struggling with enrollment. We broke out the enrollment data by geographic region listed at the bottom of this bar graph. We can see the taller gray bars indicating no change or stable enrollment for about half of all childcare programs at a pretty consistent percentage of respondents across all 7 state regions. We also see the slight shift to better enrollment rates. Last year, those orange bars that indicate slight decrease would have been much, much closer to the gray bars that indicate no change or stable. So that is a nice trend. Similarly, we see an uptick in the yellow slight increase indicator over last year. One interesting data point here is in the 7-county metro area on the far right of this chart. The dark blue bar indicates large decrease, and the lighter blue bar is large increase. There are 3 times as many metro programs reporting large decrease as those who report a large increase. It may look similar to the other regions in Minnesota, but note that the left axis here is percentages, not raw numbers. And the larger number of metro area respondents made us want to highlight this. That much of a discrepancy in large decrease versus large increase shows that there is a lot of variability among metro area childcare programs. We'll see a little later how staffing has impacted metro area enrollment at childcare centers, but we may also want to consider other factors in the workforce, including the possibility that metro area parents may have more opportunities to work from home, and some of them may not be engaging childcare as much as before the pandemic. Before leaving the topic of enrollment and revenue, it's important to note some critical programs that the state of Minnesota put into place during the pandemic. 3 years on, it's clear that Minnesota was ahead of the curve nationally in providing direct financial support to childcare providers during the pandemic. We absolutely see results of that support that play out in our data, as well as in the fact that we still have a childcare sector, which was certainly not a guarantee at this point 3 years ago. You can see here that of our survey respondents, the vast majority reported receiving childcare stabilization base grants, which have been in place since 2021, allocated by the state of Minnesota out of funds from the American Rescue Plan Act, or ARPA. The program provides a monthly grant to childcare programs based on the number of full-time equivalent employees, or FTEs, and is due to end this summer. In fact, the monthly grant amount is due to be cut in half starting this month before the program ends at the end of June. There is a proposal in front of the legislature to replace the stabilization grants with a similar program. This potential new retention grant program is supported by the governor and is funded to some level by both the House and Senate in their bills, but we'll see where it all shakes out in the coming weeks. We received a lot of worried comments from survey respondents as they wait to see whether there will be a follow-on grant program and what that might look like for them. Another support available to providers are the facility revitalization grants, which FCF is administering on behalf of the state. This program provides funding for facility improvements and light renovation for both family childcare programs and childcare centers. This is a competitive grant program also funded through ARPA. It looks like this program will end within the next year. About a quarter of survey respondents have benefited from these grants. You can also see that some programs were able to access other grant funding, with centers about 3 times as likely as family programs to access outside funding. Our survey respondents included both childcare centers and licensed family childcare programs. For these next few slides, we're going to talk specifically about childcare centers and more specifically about staffing. For the past couple of years, Minnesota's labor market has been extremely competitive and extremely tight. Childcare centers, like many businesses, have had difficulty hiring qualified staff. We're showing responses to this question over the past 3 years, asking how easy or difficult has it been to find qualified employees. You can see how colorful the left side of this graph is and know that the answer is still pretty bad. The only bright side or silver lining we can see is that in 2023, there's a slight downward trend in how many center directors listed very difficult, as opposed to now saying it's just difficult. That's the gray bar. Last year, 73% of center directors reported very difficult, and this year that number is only 61%. It's a small improvement, to be sure, but it's something. Why is it so difficult to hire childcare staff? Well, that conversation often starts and ends with compensation. Childcare workers are one of the most underpaid groups in the workforce. According to state of Minnesota information, in the last quarter of 2021, the median wage for a childcare worker in Minnesota was $11.65 an hour, with rates usually lower than that in rural areas. Childcare is rewarding work, but it's not easy. And when you can get $14 an hour at Quick Trip and your rent is going up, it's easy to see how the childcare sector can struggle to attract and retain staff. The stabilization grants I mentioned earlier were designed to support workforce compensation, which has helped. We asked childcare centers if they'd raised wages and benefits in order to attract or retain employees, and nearly 90% of them reported yes. This is a slight increase over last year when about 80% of centers said that they had raised wages and benefits. This is likely due to the high uptake of stabilization grants. But also similar to last year, the more interesting and concerning piece of information is the question of whether providers can sustain any of these wage increases. 38% said no, and 48% said they are unsure. I mentioned earlier that there is real concern within the early care and education community about what the sector might look like when the Child Care Stabilization Grant Program ends this summer. And the answer to this question illustrates why there's such interest in and frankly need for that retention grant program currently in front of the legislature. What does it mean when a childcare center doesn't have enough staff? The state limits how many children of different age groups can be cared for or educated by an adult. A center may be licensed to care for, let's say, 60 or 80 or 120 kids, but if they don't have enough staff in place to meet the ratios required for each age group, they can't operate at their licensed capacity. Over the past couple of years, we've seen centers operating with empty classrooms. They have the space, they just don't have the people. Those empty classrooms, those unfilled childcare slots, are the result of difficulties in hiring or retaining staff and have a real, tangible impact on the availability of childcare for Minnesota families. We asked center directors about this, and 65% reported that their enrollment capacity has been limited by staffing woes. We also asked them how many of their childcare slots were currently unavailable due to lack of staff. More than 200 center directors or center owners responded to this question. Those more than 200 centers reported almost 625 open teaching positions. And those 625 open teaching positions, in turn, led to a reported more than 3,300 unfilled childcare slots. Now, just a reminder that this survey and this question specifically is only a sample of Minnesota's childcare centers. So we can predict that the actual statewide number of childcare slots that are unavailable due to lack of staff is quite large. The chart above shows the number of open slots due to lack of teaching staff, that's the orange bars, in comparison to total licensed capacity, the blue bars, in each region of the state. Regarding the same question, there are some trend differences between what's happening in the metro area, the 7-county metro, and greater Minnesota. Here is the previous slide's information showing just those two regions. You can see that greater Minnesota has a higher percentage of centers reporting open slots due to staff shortages across both this year and last year. But look at that jump in the metro over 2022, with double the percentage of metro area centers reporting openings due to lack of staff over 2022. Going back to our earlier discussion about variability within metro area centers, I mentioned the possibility of more parents working from home, but another factor here is likely more competition for workers with more opportunities for higher paid positions. At the beginning of this presentation, I talked about revenue. But in order to get the full picture of business conditions, we also asked about childcare business expenses, or to put it another way, the cost of providing care. These costs include food, supplies, learning materials, transportation, and facility costs like maintenance, utilities, and rent. This slide shows how childcare centers answer this question. The only responses we're actually showing here are modest increase and significant increase. You can see that for almost every category, a majority of survey respondents chose one of those answers. As compared to last year's survey, there's a higher number of centers who chose significant increase rather than modest. For example, 75% of centers report a significant increase in the cost of food. This is higher than the 59% that reported significant increases in 2022. We've seen that many centers are experiencing lower revenues due to staffing and lower enrollment. Here we see that operating costs have risen and providers are really feeling a financial squeeze trying to make everything work. We asked the same question of family childcare providers and found even higher reports of increased costs for food and supplies. Similar to centers, responses of moderate and significant increases went up for every single category here over 2022. Family providers were also more likely than centers to report increased transportation, maintenance, and utility costs. And when talking about licensed family childcare, we're often talking about just one person. The licensed provider herself, and it's almost always her, is responsible not only for providing care, but also for going out and getting supplies during off hours. They have less time and opportunity to buy food and supplies in bulk. And in rural areas, they're spending more on transportation, including transportation costs to go buy supplies and groceries. I should note here that there is a government-funded food program that childcare providers can register for, and many of them do. That program provides a certain amount of funding per child per meal. However, that program has not nearly kept up with inflation, which was noted by many survey respondents. Like most small business owners, childcare business owners often find that the financial health of their business is entwined with their personal finances. We asked all providers whether their household income was impacted by financial losses in their childcare businesses, and most of them said yes. You can see that there is a difference between family providers and centers. While there is a slight improvement in 2023, where the number of family childcare providers reporting business impacting their household income dropped from 70% to 57%, that is still more than half of all family providers telling us that their childcare business adversely impacts their own families. And again, in the third year of the survey, we see a remarkably consistent racial disparity. The two data points on the right show that BIPOC childcare business owners, and this includes both family and centers, show higher rates of adverse household impact due to their childcare businesses. We've seen now that expenses are going up. Enrollment/revenue, while more stable than last year, isn't entirely where it needs to be. And we've seen that centers haven't been able to staff up to their enrollment capacity. So how are these programs staying open? We wanted to get a better idea of cash flow within these businesses, and here are some of the responses with comparisons to the previous 2 years. Let's start with licensed family childcare on the left. For me, one of the most disappointing data points in this year's survey is the rate of family childcare providers who say they are using high-interest financing. In our survey, we described high-interest financing as credit cards or payday loans. After the first year of the pandemic, 26% of family providers indicated that they were using high-interest financing to stay open. Sad, but not surprising, given the desperation that first year. We were happy to see the response go down to 16% last year, but this year that number has popped back up to 24%. Nearly a quarter of family childcare providers who responded to that survey are using credit cards or payday loans to cash flow their business. That's not safe and it's not sustainable. When it comes to using an emergency fund or accessing low interest loans, the numbers across family providers and centers are remarkably similar and show a welcome downward trend over the 3 years. But let's talk about tuition because I think this is really interesting. Our surveys show over the past 3 years that fewer family providers raise tuition rates as compared to centers. This isn't too much of a surprise given the different business models. No business wants to price themselves out of a market, and we received a ton of comments in our survey over the past few years from providers, both families and centers, worried about losing families if they raise tuition. They know families are struggling as much as they are. So we've seen childcare providers across the sector basically eating their losses by not paying themselves or foregoing needed facility repair or cutting back on programs, activities, curriculum for their kids. But there's only so long that any business can survive that way. And now we see that in 2023, 67% of centers have raised their tuition, 2/3 of our center respondents. And look on the left at how family providers answer this question in 2023. The rate of family childcare providers respondents reporting that they raised tuition has nearly doubled over last year's survey, from 20% to almost 40%. And many more family providers commented in this year's survey that they will have to raise their rates in the next year. We often say in the early care and education field that childcare is a broken market. Here's an indication of the childcare market actually working as a market, at least as far as the business passing along its cost to the consumer. But if families can't afford care, they'll drop out of that market and the sector can't sustain itself. And if the childcare sector fails, the rest of the economy follows. Ask any employer across Minnesota about what keeps them up at night, and you are likely to hear that lack of available childcare is a major barrier to their continued viability. So where does that leave us? We asked childcare providers how long they thought they could stay in business. We received strikingly similar responses across the state, with a consistent 20% of providers saying they've probably got less than 1 year, and a further 50 to 60% not sure how long they can stay in business. That is a concerning level of insecurity across the sector. The childcare sector for years has been losing family childcare providers in particular, with not nearly enough new providers starting up to replace those lost programs. The sector is still in limbo, with stakeholders trying to build a post-pandemic framework for childcare. There are several proposals in front of the legislature now that would provide more funding to childcare businesses and or to working families seeking childcare. I'll be interested to see what this question looks like next year once we know which of those proposals are funded and to what extent. I've mentioned throughout this presentation that we collected a lot of comments or qualitative data from childcare providers in this survey. We asked an open-ended question to all survey respondents. What would help keep your business financially viable? This word cloud is reflective of their answers. You can see how often grants came up in various ways. Grants, grant, money, pay, support, stabilization, help. And notice how many respondents mentioned food as an ongoing issue. Finally, we asked providers if they'd like to share anything else about their needs. We broke the responses down by Metro and Greater Minnesota, and this seems to reflect what we've seen throughout the survey. Metro respondents on the left, really concerned about staff, and Greater Minnesota on the right, where there's a higher proportion of family providers, their main reported need is food. And notice that for both regions, pay is mentioned second most often as what they need. So that's what we heard directly from Minnesota childcare providers in our third annual survey. Thank you for your time, and we will stop here for questions.
Thanks. So as a reminder, if you would like to contribute a question, there is a question and answer box at the bottom of your Zoom window that might be hidden in the more button there. So a few responses to questions that have been dropped in there so far. So Warsha asked 2 questions. First was wondering what the county breakdown of the different regions are. So that one is already in the answered column, and a couple of folks wondering whether the PowerPoint will be available, and it will at some point in the near future. Everybody who attended or registered will be getting a follow-up email. Vicki was wondering about how the levels were sort of weighted in the conversation about spots open due to a lack of staff. So it's tricky to compare across years with that question because the respondents that we get will influence the size of the numbers. If we get more center respondents, then the number of spots could be open because we're getting more respondents. So the way we try to account for that in this presentation, and there are a few other ways to try and do this, but the number of open slots was compared to the overall enrolled spots. So in other words, if there were more open spots relative to the number of kids who are currently enrolled in the program, then the percentage is higher. So, and Vicki, you also asked about what the regional breakdown on that was, and happy to share some data on that post presentation when I don't jeopardize my ability to follow what's going on by clicking around to too many windows. So Tess wonders if you have received any feedback on barriers to enter the workforce as a new childcare provider.
The answer to that is yes. The thing we hear most often is facilities, the availability of facilities. And this is for both licensed family childcare and centers. It can be hard if you're a renter to become a licensed family childcare program. There is a special family childcare license where you can actually have a program in a home in which you do not live. But, you know, there's approval of those by licensing it really differs across the state, so it's hard to use that as a consistent option. But really, cost of facilities, we've had providers say that they're renting a center, and the owner of the building is saying either I'm going to raise your rent or we're going to end your lease because they can make more money renting it to another type of business. So that's probably the main barrier.
Thanks. And we have a question here that is wondering, so we've talked about the changes over the 3 years in our survey. Are there any longer term trends or things that make now unique as to compared to before the pandemic that make childcare particularly difficult right now?
Sure. We are losing childcare providers. They're either leaving the business, many are retiring. There's a huge demographic shift. One thing we didn't mention is the respondents to this survey trended higher for having more years of experience. There is about to be a really huge kind of boom in childcare providers who are retiring, and we are not attracting enough young staff into the childcare workforce.
Thanks. There's also a question about interest from businesses. You mentioned the concerns that businesses have about childcare in their local community. Have you seen any approaches from businesses in being a partner in supporting the supply of childcare?
Absolutely, absolutely. we've seen a lot of it through we run a program in Greater Minnesota called the Rural Childcare Innovation Program, and often businesses are the drivers, employers are drivers in that effort to help find solutions, local solutions to address the childcare need. We've heard from a lot of employers who are interested in, what can I do? I actually have a building. I might have a facility here. Is this something that would be suitable for childcare? Or they're looking to partner with other childcare centers. There is a lot of interest, and there are probably any number of ways that businesses can be involved.
Thanks. Well, we are at time here. We have a lot of great questions. So I'll just say that my email is on the Minneapolis Fed website. We have all of your emails as registrants. So I'll try to follow up with as many of these as I can in the short term here, but please don't hesitate to reach out if there were questions you had about the data that we weren't able to get to, and keep an eye out for an email about a recording and an article summarizing the data as well. So thank you all very much for your attention today, and thank you, Suzanne, for presenting, and have a great rest of your day, everybody.